Hey, everybody. Welcome back to the Murfreesboro.com podcast. I am John Carey, your host, and we have a fantastic guest today, which I've been very excited about this episode. This has been several weeks in the making, right? But Ben Dobbs, who has just opened up True, and the True is an acronym. What's it for again?
Yeah, so it stands for Transforming Roots Unto Eternity.
Okay.
And just to kind of piggyback, the reason why we chose that name, actually, me and my wife came up with the name.
Yeah.
We want to make a long-term change for our clients. We're looking to change them for eternity, and we're also faith-based driven or inspired, so we like to
Oh, there you go.
Yeah, transform the roots from a shame into a purpose so it lasts for eternity.
Oh, nice. I like that.
Yeah.
Shame into okay. So, but True, the acronym, and then it's addiction and behavioral health.
Yes.
Yeah. So you said inpatient, outpatient, kind of all the above?
Yeah, outpatient facility. We do work as if a client calls us up or a potential client, person looking for help, family member, or whatever, and maybe they don't qualify to enter into outpatient right away, we refer them to inpatient.
Okay.
We have inpatient kind of plans in the future here, but we also service substance abuse addiction and disorders, and also mental health disorders as well, all underneath the same facility.
Okay. Nice. Okay, cool. Well, before we dive into all that, let's get to know you a little bit for the people out there watching and listening. So Ben Dobbs. So are you from Murfreesboro? Where are you from?
No, so I'm born and raised in South Florida.
Okay, gotcha.
Yeah, so I lived in Florida. I want to say South Florida as far as probably 43 years.
Oh, really?
Yeah.
Dang,
yeah.
Okay,
And,
gotcha.
Ran wild down there, I would say. And,
It's South Florida. So.
Yeah, yeah. So, so born and raised down there, and I moved up to Murfreesboro 2 years ago in June. Yeah, and we lived in Murfreesboro for over a year.
Yeah.
Did a lot of homework in the area, saw that there was a heavy need for mostly a mental health outpatient and a substance abuse outpatient, and basically in the way that we do treatment. I've been doing this for 13 years, starting facilities, and really have a good strategy and plan as far as how to service the clients to get long-term sobriety and recovery. And now currently me and my wife live in Nashville with our 3 kids. So,
Okay.
Yeah.
So was that the light bulb moment where you wanted to move up here that brought you here?
Yeah. So I would say it came off like me and my wife always had a plan to plant our roots in Tennessee.
Oh, nice. Okay.
And we just were very patient in the way, we're very God-driven, so patiently waiting on him to kind of, prompt us towards that.
I like that. Yeah.
About in 2020 during COVID in South Florida, I just started to feel like I outgrew the industry. I've worked in this industry for 13 years and kind of outgrew the territory down there, and knew that if I wanted to do it the way that I perceived it to be done correctly, I'd have to transition out of South Florida. So it was a hard move, but we went up to Panama City Beach in the Panhandle. I launched a facility there, and then northern Georgia. So we were getting step by step.
Just moving up. Okay, yeah.
And then we ended up in Murfreesboro, and that's, I would say, probably about 3 months into it, I was heavily into prayer and kind of felt that nudge of this is where we want to launch our facility and also plant our roots for our family.
Okay. Well, you said 13 years, and you've said facilities and several. So which number is this in the?
So technically, this is number 20 from
20.
Yeah,
Wow.
from launching from a consultant basis and also from like a compliance basis and operations. This would be the 5th one publicly. And
whoa.
Yeah, and so the rest of them I signed non-disclosures to be the backdrop of creating the plan, the strategy, and the program. From everywhere from state regulatory licensures, and then also the day in the life of a client, a staff member. And some of those were also turnarounds. Yeah. Not just soft launches.
Okay. Well. So it's safe to say you know what you're doing. So.
I tend to hope so.
Yeah.
Other than that, I leave.
So we're in good hands here in Murfreesboro with you. Okay.
Yeah.
That's cool. Dang. All right. So where is your new facility exactly?
It's in 730 Middle Tennessee Boulevard in Suite 10. It's located between New Salem Highway and Church Street.
Yeah.
We're about 2 miles away from Middle Tennessee State University.
Okay. Close. Gotcha. So how long have you been open now here?
We launched January 22nd. Was our
brand new.
opening day. Yeah.
All right. Cool.
Yeah.
Now, I'm just curious, over the 13 years, do you have an idea of how many patients you've seen or people you've helped?
Yeah, I've estimated so one of those launches I did was we started off at 51 beds, but the plan was a 200-bed facility in the first 2 years. So we did grow up to servicing close to about 150 beds.
Okay.
And we're
Dang.
averaging about 110 to 120 admissions per month.
Whoa.
So calculating that and all the other facilities and stuff I did, and probably over 10,000 clients.
Oh my goodness.
Yeah.
Okay. So that, man, you must have, I can imagine the toll that might take mentally on somebody with that, but that's got to be very rewarding. I mean, knowing you're helping that many people.
Yeah, and you know what? To get on the toll, so in our industry, 3 to 5 years usually equates to burnout.
Okay.
For us, that lasts longer, and there it has to be a passion. And what's interesting is within the burnout, you get the rewards, and it outbalances it, and it actually kind of inspires you to keep going.
Yeah.
The reality is us as the frontline workers, because that's what we are. We look at this as leading people into salvation and saving them from a life or death situation.
Yeah. So is that what keeps you? Is that how you personally? Okay.
Absolutely.
That's awesome.
Yeah.
Nice. Well, cool. Well, thanks for all that. Appreciate that. I kind of want to dive into what you're doing because you know we talked a little bit off camera. I'm really fascinated by what you do and how you're helping people and all that sort of stuff. So I know you have several different types of programs. So dive into those. What's one of them?
Yeah. So one of them, we service mental health clients. Anyone that's having a struggle in any mental health disorders, whether it's previous diagnosis, depression, anxiety, bipolar, borderline, anything of those things, porn addiction, gambling addiction, which we call process addictions. And process addictions are more so people that commit behaviors without evaluating the consequences behind it.
Gotcha. Okay.
So, you know, it could be relationship addiction, anything of that that covers that process addiction. So we provide individual counseling therapy. We're very trauma informed. We do have EMDR.
Okay. Yeah.
And then we do a lot of group counseling as well, where and the group counseling, honestly, is where some of the good work happens.
Yeah.
In the individual basis, it's great. It's still great work happens in there too as well.
Yeah.
But in the group counseling, where you have a good facilitator that actually allows the peers to kind of relate to each other. And the nature of it is because when we come into this as an individual, which I've had my own struggles, so I know it firsthand, is we're afraid. We have a lot of shame in us, and to be around other people that are struggling in the same areas, you know, it really creates some type of community. So we also provide medical management as well, medication management and those type of things. And then we also do the same services for substance abuse clients as well.
Gotcha. Now, you had mentioned EMDR. Now, isn't that there's not a lot of people that do that, right? If I'm remembering correctly?
Right. Yeah, it's definitely a specialty. And it's not for every client either, because to give you like a basis, because we could have a whole show on that.
Oh, I'm sure. Yeah.
Really, it's like peeling a Band-Aid off and then before the end of the session, putting the Band-Aid back on.
Ooh.
And so, and we're going down what we would call like a trauma line. So really, really reliving some of your trauma, kind of through like a meditation state.
Yeah.
You know, it's, there's some tapping involved and all those things, but the facilitator, the therapist we use is based out of South Florida. He's a good friend of mine. I've worked with him since 2013. And he's very intuitive to where we call it where he's able to read the mail of a client. So there's good success in that within a 45-minute session.
Dang.
And we try to qualify them if they're a good candidate for EMDR, because sometimes they have to have good stability, maybe 30 days of sobriety and living in a good environment, because it can bring up some triggers and some other stressors from the past as well.
I know very little about it, kind of scratching the surface, but I've heard that, like you said, peeling the Band-Aid off and all of a sudden flood of emotions or things that come back that they had suppressed or different things like that. Is that what you're addressing?
Yeah,
oh my gosh.
Absolutely.
Ooh.
So it's kind of like, and this is why we're cautious with it. So to piggyback, the first thing we really do is called a CEMA, and it's a cognitive emotional memory assessment.
Yeah.
So every client that comes in, they get a CEMA when we feel they're ready for it. And it's usually within the first 2 weeks. Some people come in where might be experience some type of mania or just, you know, real anxiousness. So we try to wait till they land through our program as far as the groups and start kind of landing in that area mentally and emotionally. And then we'll hit them up with the CEMA. Some clients are able to do it right away. And based off of that CEMA, it kind of tells us what our treatment plan will be based. If they're a candidate for EMDR, maybe they just need good grounding techniques and skills.
Gotcha. Okay.
We're still going to explore the trauma, though.
Oh, yeah. Well, just the fact that you do EMDR, because I've read a little bit about it. I know somewhat about it, but it's not something that a lot of people do. Or like you said, it's a specialty. Not a lot
Yeah.
of people can do it, I guess, right? Or
Right.
trained in it. So the fact that you offer it's pretty neat. But I want to back it up just a little bit
Yeah.
on something. So are you guys, like, do people just walk into your facility? Are they referred to you? Like, how does the process go for somebody to start treatment with you guys?
So really, it's kind of like in a 3-piece model.
Okay.
Some people do walk in,
Okay.
and then we do get referrals from other treatment centers. Maybe they're not a fit at their program. Maybe they took care of their substance abuse issues, and now they want to work on their mental health.
Gotcha.
So we do work with other providers, other treatment centers, hospitals, interventionists, peer support specialists. We do work with those in the community and also throughout other states. And then the third way would be through search engine optimization on Google. And usually it's the moms. The moms are the high percentages in this industry, in this field, where they're the ones seeking the help for the individual, the family member, maybe their spouse. And so they'll Google us and find us and see if we're a fit for them. And really all it is they call our admissions team and we qualify them, kind of let them know what they would receive at our program, and then we go from there.
Well, what is something you see more often than others? More like depression, anxiety, or what do you?
I would say to go back, even when I was unaware of it in the beginning stages, because I entered this industry coming off of my own battle. So I went to a 10-month faith-based program.
Okay.
And I needed it, man. I was homeless for about a year and a half.
Oh, no kidding.
I ran an addiction for 15 years. So
wow.
When I came out of that, I just wanted to help people, whether it was in ministry or whatever. And I got in this industry as like a entry-level position.
Yeah, okay.
So doing that along the way, I started seeing the needs and maybe ways it could be done better. And then when I started to get educated, I started being more aware. And I would say there's a heavy battle. And I don't want to generalize it and sum it up and think everyone out there is afflicted with this, but substance abuse, because of the chemical substance, creates a depression, anxiety.
Gotcha.
And so that creates the brain dependency on it. So now we're self-medicating to get over the depression, anxiety because it makes us feel good, which is a false sense of reality. So depression, anxiety runs wild in the majority of mental health afflictions and substance abuse afflictions as well.
Dang.
Those are the two primary mental health. Now, as far as substance, everyone's aware of the opioid epidemic.
Yes.
But there's a heavy alcohol epidemic that in some cases the opioids take out more people per day. Yeah. But long term, you see more complications through alcohol dependency long term. Time.
Yeah, I've actually I've had personal experiences with alcohol in my family.
Yep.
And I unfortunately some of them are not here with us anymore because of that. Yep. But actually it was like 10 years worth. Like you said, the long term, but seeing like the final days, like I still get, sorry if I get emotional here, but
I understand.
I still, like I can see my family member in the hospital bed going what they were going through. And it was like, that was all from alcohol addiction. And it was rough. It was rough. So.
No, it's hard to watch because it's the dependency on that. And it's interesting because I don't know where National Institute of Health, I hate to quote anything.
Yeah, no, I got you. Yeah.
But I will say the statistics that we know to be true is 2/3 of American families are affected by addiction. And that summarizes it, whether it's opiates or alcohol or
just
marijuana.
Addiction in general.
Yeah, just in general.
Yeah.
And so that lets us know that usually there's someone out there that's affected by it, but opioid disorders and the average span is 2 to 5 years to where it becomes heavy complications, or some people have that aha moment, I need the help. Yeah. And listen, they can outrun the 5 years, but that's the kind of medium range. In alcoholics, it's usually 10 to 20 years.
Really?
Yeah.
10 to 20 years.
Yeah.
Oh my goodness. Okay. So are they with you that whole time, or
not with us? But those are just the people complications. Those would be the individuals that call us, and that's kind of the statistics to show like where. And I would say marijuana is the most permissible.
Oh yeah, I gotcha.
One that is not by our sense, but and it does create depression, anxiety as well. But it's more acceptable, and that's what alcohol is more socially acceptable as well. So it takes longer for them to come to the end of it or ask for the help. And we see the opiate users usually 2 to 5 years because one, the cost of it and the need of it. Someone can blow through $50 to $100 quickly, and then when you're on it, sometimes you're unemployable. You can't maintain a job, and when you don't have it, you get sick. Yeah. So that's what kind of keeps it to where they come to the end of their lifestyle, I would say, usually in a range of 2 to 5 years.
Yeah. Is that hard? I'm just curious because what I saw personally and dealt with like the alcohol side, I mean, you have functioning alcoholics
Absolutely,
that you would never know. Like I particularly, someone would be 5-6 drinks deep, and you would never know.
No.
And I mean, if they would blow into the thing, they would register drunk, but they're just walking around fine.
Yeah.
Aren't there some like prescriptions, for example, that can kind of mask the effect of alcohol?
Some sense. I mean, it's interesting because outside the prescriptions, a lot of people with alcohol will maintain, and I'm not saying this for every alcohol.
Yeah, no, I get you. Yeah.
Some people will add a little bit of cocaine to the mix.
Okay, I got you.
And they necessarily, that might not be their drug of choice.
Yeah.
But you can maintain on a buzz of alcohol. And it's interesting because it comes from a tolerance level too as well. And that's more biologically to where you kind of have those first couple drinks and you buzz.
Yeah.
But you might seem yourself to other people because this is your transition every day. You get that buzz, you go about your life.
Yeah.
And then once you kind of feel it coming down, you might drink a little bit instead of consuming a bunch at one time.
Gotcha.
Which would equate to being drunk. And some people build a tolerance so much that they never hit that ceiling of that pass out type of thing into where they're just maintaining.
Yeah. Yeah, because I can't remember what it was. You have to excuse me, but I do remember there was a certain, in my experience, it would 4, 5, 6 drinks, but because of the prescription they were taking, it masked the effect of the alcohol. But then once the prescription wore off, kind of towards the end of the day, it was like all that alcohol, bam, all at once.
Yeah.
And then they were boom, and then next thing you know, they can't walk. And it was it was pretty. That was pretty hard to watch, to be honest. But
yeah, and it's interesting because you see this back to those tolerance levels, and what it is, it's really brain chemistry. So like our endorphins, once from crystal meth, crystal meth is the highest to where once you take those first couple hits, you sealing out your neuron pathways to where that feeling, in opiate addiction, we call it chasing the dragon. Chasing the dragon, yep. But like you bottom out. So like you level up and you're chasing that. You'll never really receive that next high.
Really?
So same with alcohol. We all have that sense of whoever's tried it, we reach that drunkenness, we spin out, we lose control, we're spinning. Yeah. Maybe there's some vomiting involved.
Yeah, right.
And we pass out. And so over time we build a tolerance level to where the body might not reach that high or that kind of false sense of elevation that you're looking for. And so the body just has a way of kind of diffusing that, but still you can consume a lot of alcohol. And this is why alcohol poisoning is a factor. And some people can drink all night, but then when they shut down at night, 2 hours later, it might catch up with their body.
Yeah. Oh, man. Okay.
Yeah.
I know we could go into a whole episode about all that,
Absolutely,
but for time's sake, I'll keep it moving. So, but on your, as far as back to the programs, like you were talking about inpatient and outpatient, and then you have some that are kind of a mixture, right? The sober living home type stuff.
Yeah.
So what all you got?
So we're working on getting our own sober livings.
Oh, okay.
We do work with sober livings in the area of Murfreesboro, and we've had good success with that. We will probably be developing our own homes and own program out of that, recovery homes, probably in the month of May.
Oh, okay, right on the corner. All right, cool. Here locally in Murfreesboro?
Yeah, absolutely. Yeah.
Now, are there plans to expand out at all, or?
Yeah, and we want to do it in two levels. So our recovery homes, if that warrants expansion, there's a heavy need in certain areas of Tennessee.
Yeah.
And also there's a heavy need for mental health recovery homes. And that's what we kind of want to specialize.
Yeah.
Our program is based off of like how we elevate and experience in a sense of what is the need per level of care. So our next step would be more of an inpatient.
Okay.
I just foresee some of our recovery homes expanding quicker than the facilities.
Yeah, I got you. So that's a little more prevalent in the area. So do you think it has something to do with, I've been told, like Nashville and Murfreesboro, you've got the two biggest highways in the country that intersect right in Nashville. So there's a lot of drugs that go through Nashville.
Yeah, so it's considered what is called, and I might mess up this acronym, but I know that it's called HIDAT, so it's a high drug trafficking area. Yeah, so because in Nashville you can be in 8 different states in 3 to 5 hours total.
Yeah, right.
Unfortunately it's a good roadway for not only sex trafficking but anyone that is trafficking drugs as well.
Yeah. Yeah, we actually got into that a little bit on another episode a while ago. And I had been told that many times by people with the 24 and
65.
65, yeah. They intersect right in Nashville, and it's like the amount of stuff that you don't even know is going right through, and may not be necessarily a stopping point, but the stuff that goes through here.
Absolutely.
So, what ends up, as a byproduct of that in our neighboring cities, so. Yeah. But I've always wondered about that with that sort of thing. But so, I've got my notes here. You guys also offer like a 12-step program.
Yeah, so we do we're very eclectic. So we want to meet everyone where they're at.
Yeah.
And what we cover is our modalities of how we treat people, and kind of the philosophy behind it is whatever is going to treat the four components, which is the physical, the mental, the emotional, and the spiritual.
Gotcha.
So however we can do that 12-step program, we have a therapist that's highly trained in 12-step immersion. CBT, cognitive behavioral therapy, DBT, which is more of an emotional mindfulness, being present in your emotions and having skills and regulation of that.
Gotcha.
We do an eclectic thing. I have my own curriculum called Tools for Transformation, which is like a blend of spirituality meets cognitive behavioral therapy. So we do whatever it is that's needed for the client.
For the client.
Yeah.
Okay, cool. Now, I'm curious, and I don't know if we can get into this or not, but it's do you see like a certain demographic? Like, do you see more people? Okay, for example, the alcohol that I was talking about in my example, that particular family member had done very well for themselves in life, like they, very successful, lots of money, all that sort of stuff, and is now no longer living because of this alcohol problem. But it was just something, owned a big company, had lots of employees, that sort of stuff. You never kind of thought they would necessarily, quote, have an issue. Right. And then you have this underlying thing that ended up taking their life. Like, do you see any type of demographics more than others or anything like that? Or does it affect certain families more? Or?
I would say based off of two things, and that would be your environmental. So we in psychology, we have this thing based off of environmental perspective of how those can lessen the chances of people having success and or heighten the chances of them having complications as well. And then the learning perspective, example, growing up in your household or what's offered at school. I remember in fourth grade, I skipped school for the first time, and my neighbor comes over who's in 8th grade, offers me a shot.
Oh gosh!
And at the time, I knew my parents had a liquor cabinet.
Yeah.
So we definitely hit that up that day.
Yeah, I gotcha.
So that was based off of my environmental and what I have learned, right? So those things can have a heavy impact on people. And then it's kind of like the social status, but regardless, the main thing that never changes outside of those, because you got people like your family member, and my heart goes out to you. I've been in those things, and it's rough.
Thank you.
Most of the people that have success there's that underlying damage of shame. And maybe they have insecurities, and pride is interesting because pride is insecurities, and those insecurities will tell you that you don't need the help. Yep. And then the pride and insecurities will tell you you need the help, but you can't do it. Yeah. So it's those are the underlying things. That's why true transforming roots, that's what we go after. We go after the underlying shame. We try to dodge going over the surface and going underneath as quick as possible because that's really what's going to heal people. And this is a long-term journey.
I get it.
In facilities and outpatient facilities, and I would challenge anyone else that says anything different, but we're really building a foundation, and we're tearing down the old foundation and building a new for them to, and we're planting seeds to grow up a new tree for their life, right? So it's the underlying causes of shame, and sometimes it's proven external success doesn't mean that you have internal success.
I like that wording. I'm going to use that. So, in your experience, have you ever had a patient that you've been treating, or somebody that comes in that is just like, I use the phrase when you find out the basement has a subfloor, like the bottom of the bottom, and then years later you see them and they're like, boom, like complete 1,000 miles in the other direction. It's
a lot of those stories.
Really?
And awesome. I can say this: those are the ones I really like because that was my story. Yeah. I was hopeless. I didn't think. When you're on the streets, I was on the streets I was kind of couch surfing, surfing for a year, and then on the streets, strictly homeless for over a year. And so I've seen the bottom. I've lived it. I also lived those complications for 15 to 20 years. But those are the clients I love. And I will say one that always sticks out to me. We were a faith-based program, Agape, down in Fort Lauderdale. And all of us, as far as the clinicians, the case managers and everything, all the staff was believers. And in comes walking a guy with like a satanic jacket on. He had the emblem and everything, and like I worship Satan, everything. And my case manager came out, was doing the intake, was like, I don't know if we can help this guy. I'm like, just let's keep doing it. Let's love on him. Let's keep doing it. Let's give him, the skills that he needs. and and this was probably in 2018, 19.
Yeah.
He just messaged me on Facebook saying that now he's getting a job, which he does. He has a job in this industry as a behavioral health tech.
No way.
He goes to church. He serves on the team at church.
Oh,
so those are some of the stories.
Yeah.
And honestly, I have a lot because no one comes into any facility on a victory lap.
Well, yeah, I
You know,
get
so,
that, yeah.
but you're exactly right. Some are sub-level brokenness to where, to see that. And honestly, that's one of my passions, man. That's things that keeps me alive. That's something that makes you want to go through the wall like the Kool-Aid man back in the day.
Yeah.
It keeps me energetic and alive and inspired that, you know, and the main thing is based off my own story.
Yeah.
And I think that difference with some people, when you've been through it and you know you can overcome it, you know how lost and confused and broken you were, it's, you kind of know what they need.
Yeah. So is that like if somebody comes in on that level and you kind of see yourself in that, like just like, hey, I was there, you got this, let's go. Is that the fire that you get?
Yeah, and it's and honestly, sometimes you have to. When I do groups, it's kind of like you have to not and from authoritative, but you kind of have to speak authority over their degradation, right?
Okay.
So it's like, it's in a sense of saying, hey, like instead of being hopeless, like there is hope, you can do this, and that's where me personally, I will share some of my hope, strength, and experience through that. But those are the ones that like I love to go in after, and sometimes my team will be like, you know, the behaviors, and you know, it's not that they want to give up, but there's just it's difficult, and I always try to put my 2 cents in or intervene on that. At the end of the day, we can help anyone and everyone. They have to be willing and motivated, though.
Okay.
And so.
Well, just going off something you said with your colleague, has there ever been somebody that came in that just couldn't be helped?
Yeah, and I would say to go and to not like come again what they can be helped.
Yeah, or they have to want to be helped, right?
Outside of that, if it's in that category, then it makes it difficult. And honestly, sometimes it's one of the biggest things I don't stand for is like the violent behavior. So if someone like physically or verbally gets aggressive that can't be de-escalated, it's not going to be a good fit for us because you have to. Especially a leader in these facilities, you got to treat it as you're shepherding the flock. So you don't want to ruin the rest of the community. Yeah. Is that life worth saving? Yeah, absolutely.
Of course.
And you still want to keep in communication with them, but to go back to your comment, they just weren't able to be helped.
Now, how do you? I'm just you personally. Like, how do you? I did an internship in college. Like for those that don't know, we almost went along the same path. We were talking, you know, off camera, but I did a couple internships in college where I was dealing with some people that there were times where I was like, oh my God, I'm just gonna say it, like I want to punch this guy in the face. Like you need to chill out, and they would just get violent and they get in your face, and you have to keep your cool. But there were times I walked away and I was like, I have a whole found respect for people that do this because you know the people on staff would come in and would handle it with such care, and it's like they were tender towards them, and I'm sitting there like, God, I was raw, and I'm like, how do they do this? Like, how do you do that? How do you keep cool with people like that?
So prayerfully, but I would say also for me, my foundation is the Word of God. So I stay in that, and again, for those that are unbelievers, like if you look at the word Holy Bible in Greek, it means a good book. So I come from my deliverance of a sense of my actions every day, and I try my hardest to follow that good book. And having the patience and empathy, but also knowing that the person on the other side is sick and suffering. Yeah, I got you. And then we get into that word called compassion, which means long suffering. So just having the grace and mercy behind that, and understanding that they don't know. It's kind of like that forgiveness aspect of they don't know. And honestly, I've seen more people get elevated that we hit them with some love and grace and mercy, and the reaction they're hoping to get from us isn't the thing. And they react and respond differently. Yeah. And then some people have come to us and said, hey, man, I'm going to stay because you guys show me love that I've never seen before. Yeah. Yeah. So, and listen, if I've had those times, right? I heat up and I just remove myself from the situation. And for me, I've learned over the years, it's because of the trauma response that I have from my upbringing and the lifestyle that I chose that when things got aggressive, we went head on, right? Yeah, but it's a lot of forgiveness, and also the thing that always has to stay at the forefront is if this individual isn't willing to adhere to that, there's others that are.
Yeah.
So it's just not a one-stop loss, you know? So.
Yeah, I got you. And just to clarify on my part, that's not like I was getting violent with them.
It
was more of I was an intern. I had never experienced anything like that before. So when somebody gets in your face, especially as a man, you're like, oh, excuse me, and then you realize they're battling. So like you just said, hey, there's a person there. Like, I need to chill out, you know, like you're here to help, you know? And I got that very quickly, especially with seeing the staff and how they handled people. And they would diffuse situations like that. And you're like, oh, that was great. You know, so just to clarify, for people watching, don't think I'm out there causing fun. But cool. But so back to your Murfreesboro facility, like being up here, and then you've been here 2 years, you said?
Yeah.
So what's your vision? What do you hope to accomplish with your Murfreesboro facility here?
You know, to help as many people as we can. That's a key thing. You know, and in doing so, we also want to be a blessing to the community as well. That's our next thing, and that's some of the things that I'm preparing for going into May.
Okay.
We want to be able to give back, and right now we do give back to the community of offering free treatment for those that are willing and motivated.
Nice. Okay.
But we also want to get back into the community of whether it's helping the homeless, you know, joining forces. And if anyone's listening to this podcast that's out there that can do this, call us, because we're looking to join forces with some churches.
Okay.
We're looking to join forces with some outreach campaigns, whether it's feeding, harvest feeding or communities or anything like that. And then also to the homeless. And so I did a paper, one of my final papers in my master's degree for the homeless. And 85% of them struggle with mental health or substance abuse.
Wow.
It's equivalent to those that are incarcerated as well.
Okay. All right. Got it.
So I like to view it as, and I did this in my paper, that they are spiritually incarcerated, right? And emotionally and mentally incarcerated. So any way we can get going on that. We do have plans on starting a nonprofit. So
very cool.
We don't have to turn anyone away that may not qualify financially for our program. Because we can only give so much free services out. But yeah, so that's kind of our plans in the wheelhouse, that in May we're going to start moving towards that, and really just start hoping and helping to rebuild, you know, communities.
Nice. Okay. Well, I know just a couple people popped in mind and need to introduce you to. So,
absolutely, yeah.
Yeah, the church that Jen and I go to, Experience Community, if you've heard of them.
It's familiar. So that was my home church when I was up here.
Nice. Okay, that's where we go. And Corey, the pastor, actually a longtime friend of mine, and they do so much for the community and the homeless and everything. So if you haven't already spoken to them, we can.
I haven't, so I need to.
We can make that no problem. So
yeah, and it's interesting because I noticed that big time, and I know he has a backdrop of being an alcoholic and stuff like that. He shares that in his sermons. And so that's something, but we love the fact that our kids love the children's ministry there too. We're in Nashville now. We go to the Belonging because it's 10 minutes away, but we do come to Experience probably once or twice a month and sit down. But we love the fact that every month they highlight a nonprofit that gives back to the community. And so we're also launching a recovery church after April 15th, probably into May, where it's called the Recovery Church Movement. Now it's different than Celebrate Recovery. We're more 12-step emerged, but kind of similarities. And we know Experience Church does theirs on Thursday, so we're looking to do ours on Tuesday and Wednesday. But absolutely, any way that we can combine. I'm an ex-pastor, still ordained as and licensed as a minister, so that is our heartbeat to help. In our industry, we're more of like, you know, wise as a serpent, gentle as a dove, and we take our model as planting seeds. So we like to team up with communities and know that, hey, we'll go out there on the front lines and help and bring the people into those senses.
Very cool.
Well. Yeah.
See that? Oh man, that's okay. A testament, like to you and to Corey, we were just talking about, because your backgrounds and what you've done and what you, I mean, you're like the perfect people to do what you do. And so I think the meshing of you two and Corey and his team and the church and Kyle and everybody over there, you guys could probably do some wonderful things in this community.
Absolutely,
so. All right. Hear that, Corey? I know you watch these. I know you do. He's mentioned it before. So, but anyways, okay, cool. Well, we'll talk about more about that off camera. But I do want to be cognizant of your time. I know you're busy.
That's
you got a lot of stuff to do.
I got some time,
All right, cool. I just want to make sure I didn't run over. So, but so more on the programs. We got your we talked about the holistic stuff, didn't we?
Yeah, so the holistic, what we do is we do, we just brought her on board. She's amazing. She does yoga, and the reality is not everyone's going to want to do yoga.
I got you.
So she has an interesting approach. So the holistic approaches we do is we have yoga. We talk a lot about spirituality and equate that to trying to formulate a belief in something greater than yourself, but
Yep.
then also character.
Yeah.
We formulate it to spirituality being character. Then we do a drum circle. One of our therapists is
Okay.
a percussionist. He's an
Yeah.
ex-drummer, so it's pretty cool to listen to them get wild and go in
Oh,
unison.
no way.
And
Yeah.
so we do art therapy as well. And forms of meditation. That's our holistic approach.
Okay, cool. Yeah, I just saw in my notes here the holistic approach. So,
Yeah.
I like how you mentioned it earlier. Like I see all my notes here and all these bullet points, but basically you guys just do whatever's necessary
Yeah.
to help the person.
Yeah, whatever we can relate. So that formulates. We formulate a treatment plan usually after the first 3 days of them being with us, and that covers their pre-screen assessment, their medical history and
Okay.
physical, and then we do a biopsychosocial. So when we get all that, that's really conceptualizing all the history of
Yeah.
a client, what they're willing to say, and what is pertinent at that time,
Yeah.
right? Because more of the story might be revealed 2 weeks later, but that's how we develop our treatment plan. The treatment plans can forever change as well. Like
Yeah.
they can kind of move as they go with the client, more is revealed.
Yeah.
But we do understand the focus of trauma, and trauma is in the eye of the beholder. So what might not have been a trauma for me might be trauma for the next person.
Yeah.
So we really approach it that because addiction itself creates a physical trauma. And mental health complications create an emotional and mental
Yeah.
trauma as well. So we really dissect those things, and then we meet them in their belief system. So if, maybe if say that they're atheistic and, going from the God approach might not be the right thing at that
Yeah.
time. So we definitely meet them with that. At the end of the day, we're just trying to help people go out, and our model is change a person, change a family, change lives, change a community.
Yeah. Yeah, I gotcha. Do you ever see people that can, I guess it's probably like you said, people that want to be helped versus non, but like people that pull themselves or can really pull themselves out of it versus needing help? Like,
I've seen it, and it's interesting. I've seen it very few times.
Okay.
But I have seen it where people are able to do it. And I will say I will never turn against someone with that as long as you're willing to make the change. It's a harder battle.
Yeah.
It's a harder battle. And I remember I went to my 10-month program, and I had to endure that thing because it was a work program. And I'm getting ready to graduate, and there was a service that night because it was a faith-based, since we had church service. One guy comes walking in, and wasn't in our program or not. He was off the streets coming into church. And he claims he was a crack addict and this and that. And he goes up to the altar, he gets prayed over everything, and then leaves the church. And here, I'm getting ready to complete my 10-month program. And I was just like that guy, right?
Yeah.
So 2 years pass, and I'm a traveling minister and pastor, and I go to this one church in the city that was a revival.
Yeah.
And this guy comes up and he speaks his testimony. I'm like, yeah, I've seen that before. And then we start to talk, and it turns out it was that guy.
No way.
And he was 2 years clean and sober. Now, what he did do, though, is he plugged himself in anything and everything that he could, because he didn't have money to go to a facility or treatment center. And I will say, in the 2 years of what he shared in his testimony, probably could have been prevented in some of those hardships, and he would have achieved it probably quicker in 6 months.
Okay.
So there is that balance of like, and even from a biblical sense, it says in the midst of counselors are safety.
Yeah.
So like the plans are there for that, to have counselors in safety, and we know Jesus is a wonderful counselor. So anytime that we can get it into the sense of that community, because people recover in community.
Yeah.
I would say that that's more evident to get into there, where you can have quicker success and have a foundation for long-term success instead of learning it on your own.
Yeah.
But absolutely, there are people, and going back to your earlier statements, is those that are too far gone is going to be difficult and experiencing that hopelessness. But some that maybe just started. I've met people that been smoking marijuana for 6 months now, and they're able to put it down with a little bit of therapy or maybe some self-help groups and stuff like that. So I think it can be done. Plug yourself into a church. For anyone out there that's struggling in that area, and maybe you don't have the ways and means for treatment, plug yourself into a church, plug yourself into self-help community groups. Can you do it on your own? I never doubt the human will. And so, but if you can have it a little easier, and less hardships, and find yourself a community to get attached to, connect to.
I was curious on that one because, and I've openly talked about this before with people, but it's not too in the distant past. I went through a situation myself where that basement had the subfloor type moment.
I love that.
And and it was just I was always under the mindset, if it's meant to be, it's up to me. I can do this, I can do this, I can do this. But it was so hard. Like, I mean, literally laying in bed for 6 hours watching the ceiling fan go, stuff like that. And not kidding, 6 hours plus, and then some. But just to get up to brush my teeth, was really, I was in a very depressed stage in my life and things that were going on. But with that being said, as soon as I realized like I need some kind of help and just leaned on people that were close to me. Yeah. And a big one is that beautiful lady up front, Jen, helped me out. And got me back into church because I was big into church years ago and I kind of fell out, now we volunteer at the church. We do things, awesome. Thank you, Corey and Kyle and all their team. But I got baptized, all this sort of, but leaning on those people to help and everything just went and just, I remember having a moment in church where I was literally sitting in there by myself. I walked in, they left it open, and I just said, all right, gloves are off. What do you want?
There it is.
I'm here. Yeah. What do you want? I give. What do you want? And there was a moment we can talk about later if you want. But ever since then, life just kind of went in a different direction. And even with other things coming at me that feel like, somebody's trying to punch you in the face, with something. And you kind of, okay, I got this. I can take it. This may suck for a minute, but I got it.
Absolutely.
And so that's why I was asking that. So even people that think I got this, it doesn't hurt to just get a little help.
Yeah, it's a longer, difficult, and you hit two key things is by you sharing that moment of walking into that church, right? There's two things that people are going to need to do, and that's surrender and then submit, right? Surrender and submission. Whatever you're submitting to, and we don't mean that in a prerogative way or anything like that. It's surrender and surrender to your lifestyle, and then submit to something that's going to guide you. And that's why people doing it on their own. There's hardships because you didn't have the coping mechanisms or skill sets, right, or foundation to achieve it. That's why you've been using or struggling. So if you're not going out there and getting that information, right, and being intimate in the knowledge of it, you're going to have a hard time and struggle. And that's why, again, the opposite of addiction is love and connection, and that connection has to be driven to community.
Yeah. No, I love it. Yeah, so I love what you guys are doing. So this is fantastic. When we first started going back and forth, I was like, oh man, we got to talk about this. This is cool. So cool. But when you said going out and getting that information, speaking of, how can people find you? Social media, website, phone number, whatever. Throw it out there for everybody.
Yeah, so they can visit us on our website, which is trueaddictionbh.org.
Okay.
And also we have our Facebook page, which is under True Addiction as well. Behavioral Health, just search us. We're there on Facebook. I want to say our Instagram is at trueaddictionbh as well. We have a LinkedIn page as well. So anything, if you go on there, True Addiction Behavioral Health, the name is original, so I don't think you're going to find any other options. And they can find us there. They can give us a call. I do have the number, if that's okay.
Yeah, no, throw it out. We'll put it in the description. Everything you're talking about, we'll put it in the description and link over so people can find you.
Yeah. So the number they can reach us directly is going to be 615-338-6235.
Got it.
And they can reach out. And even if, you just want to, we have some people that call that maybe in the midst of their drunken state and they just want some hope and strength. And we will tell them they need help, but so we're there. If you're struggling with anything, we're willing to do those things as well. So
And please, on a side note, please, if you haven't done this already, tell me you have plans for a True Addiction podcast. Because having people on there, testimonials, that thing would explode.
So I love it, and it's interesting because this is kind of one of the first ones I've ever done.
Oh, okay.
And as I was walking in here, my admissions counselor reached out to me. He's like, "Hey, I think I want to start a podcast."
You want to use this? You can
absolutely,
use this. That would be great. So.
And you know what the main thing is I think just getting the message and the word out there, and even honestly, and from the faith-based component, we live in some very serious times nowadays, and things that are happening in the world, and it's a way to push out the message to know that to get help and to overcome all your complications or your burdens and your struggles. Is you're equipping people to be a soldier, man, and like fight the good fight of faith. So, absolutely, and we want more people. I'll give you an example. One of my drives for doing this is I didn't know when I was struggling. I didn't know there was a way out. True story. I thought all treatment centers were for the Lindsay Lohans at the time. Because I got clean sober in 2010. I had no insurance. I had nothing, and I went to my house arrest officer.
Okay.
Thank God, he's a great man of God. He saved my life, and so did my sister. But yeah, I went to a faith-based program, and man, it was rough, and I ended up relapsing. That's why I ended up becoming homeless for a year. But I knew I had to go back to that, and I went to a free program. So until I got empowered with knowledge, man, I thought that was the cards I was going to be dealt. I was hopeless. Man. So I think just being able to pass the message without them having to come to a facility, I think that's vital, and those are the things that we want to talk about.
Oh my gosh, okay, man, I love it. So. Can we have you on again and do like a part 2? Like I want to
absolutely
dive more into this. So, and the stories and stuff that you're talking, how you're saving people, helping it. Oh, it's very inspiring. So yeah, I'm gonna go conquer the day now. This is great.
Awesome.
Thanks.
I appreciate it. Yeah.
But for those watching and listening, I put everything you just mentioned. I'm gonna put in the description. So
okay, great.
And it's trueaddictionbh.org.
.org.
If you want more information, and then the phone number, I'll put all that up. So
yeah.
So if anybody wants more info, they can find you. And then I know I'm trying to watch the time here, so I'm gonna wrap it up for you so we can get back to work.
That's all good, yeah.
But man, I appreciate you coming on. Thank you very much. And again, for all those watching, listening, in the description, all your info if you want more info. And that's it on this one. So for everybody watching, thanks for tuning in. We'll see you on the next one.
Thanks for having me, man.